Welcome to Wellness Wednesdays, where I teach you how to live a healthier lifestyle. I'm Dr. Julio, and today we're going to talk about Botox. So Botox, I get a lot of questions. What is Botox? How does it work? Does it really work? I'm really afraid of it. And so I'm here to debunk all those myths. So Botox is a protein. It's derived from the bacteria botulinum toxin. So everybody's afraid of this a toxin, is it going to damage me? Well, what we're injecting is not actually the toxin. It's actually a protein derived from the toxin. Much like, antibiotics were derived from bacteria and fungus back in the 40s, and everybody was afraid, oh no, I'm going to drink bacteria. Well, it's pretty safe. It's one of the most popular procedures, most often prescribed cosmetic procedures done. So what we're actually injecting is actually a protein. Botox works by relaxing the muscles over the skin. Every time you contract the muscles, the skin folds. As the skin folds, it creates a wrinkle. So by Botox relaxing the muscles, your skin doesn't fold and therefore doesn't create a wrinkle. The more you do this, the more relaxed the muscle becomes, and the more relaxed the skin becomes over it, and hence no more wrinkles. Botox can last anywhere from 3 to 4 months, and the reason is because the protein blocks receptors on your nerve endings, preventing them from communicating. And your body changes those receptors every 3 to 4 months. Typically, if you're doing Botox on a regular basis, most people will claim that their Botox lasted much longer. And that's because the muscles are actually weaker, so the effect tends to last a lot longer. Botox is administered by tiny little injections just under the skin. The procedure is minimally invasive and therefore minimally painful. We use usually a topical anesthetic, so we numb the pain, sometimes a little ice that numbs it even more. Once we administer the Botox, the results aren't immediate. The Botox usually takes anywhere from 3 to 7 days to take effect. The whole procedure is probably only 5 or 10 minutes, and the results could last anywhere from 3 to 4 months. So really anyone can become a candidate for Botox. The goal for Botox is really to get rid of not just the active wrinkles, but the wrinkles what we call static wrinkles. When you're not making an expression, your forehead, for example, should be completely smooth. If you have lines on your forehead without making an expression, then those are the lines that we're really trying to target with Botox. By administering Botox in these areas and allowing the skin to relax, over time, those lines should disappear, and what we call static lines should be no more. So the 3 things we recommend to do or not do the day Botox is administered is no strenuous exercise, no direct sunlight, and no excessive alcohol. That means no happy hour, guys, okay? The reason for this is because when you exercise or you're out in the sun, what ends up happening is that blood rushes to your head. When we inject the Botox, you may get a little red spot that usually goes down in about 20 minutes. If you do any one of those 3 things, typically those little red bumps will last from 3 to 5 days and could become tender. So really avoid strenuous exercise, direct sunlight, and excessive alcohol. Okay, well doers, so we learned about Botox today. So if you're still contemplating Botox, if you're not really sure, feel free to send me an email. I'll be happy to answer your questions. Or you can follow me on Facebook, Twitter, or YouTube. I'm Dr. Julio, and remember, turn your illness into wellness.